evening. Good to have you with us in this edition of the Urban Debate. We start with a controversial debate that's taking place within our medical fraternity right now. It's not the first time that the modern science is clashing with the traditional one. It's not the first time that we are seeing a fight between allopathy and Ayurveda. But in the recent times, we've never seen the Indian Medical Association come out and express such furor and outrage about a decision that has been made by the Ayush ministry. Now, essentially, there was a notification that came which said that the government has allowed surgeries that will be conducted by Ayurvedic doctors. There is an amendment that has been made in the existing rules which says that even those PG students can conduct a certain set of surgeries. Now, 39 general surgery procedures have been added by this notification. 19 of these procedures involve eye, ear, nose and throat related surgeries. This is what has caused the Indian Medical Association to get really upset. And they are outraging right now about this. They've held news briefings, released statement after statement. They're saying we need to resist this retrograde step of mixing systems, that the government must withdraw the order on surgeries. Every system must grow on its own strength, and that mixing the system is foul play of the first order. And of course, this has seen a response coming from the government, from the Ayush ministry, that says that there is no mixing of medical practices, that what we have allowed is still a restricted types of surgeries. What we have allowed for the PG students to carry out are still restricted to only 58 kinds of surgeries. But these scholars, the PG scholars who are studying and training to become Ayurvedic doctors, also need practical training, and that we are committed to maintaining the authenticity of the medicine system. So this fight is really going on. IMA says this is all khichdification. You can't give what is traditionally part of the modern medicine and allow the others who follow other kinds of science to come into play. So the big question we are asking this evening, is there anything new in what the government has allowed? Is there anything dangerous to what has been allowed? What is it that the IMA feels could be a concern, and how big of a risk are they talking about? Let's say good evening to Dr. Asmita Vele, professor at the College of Ayurveda at the Bharati Vidyapeeth in Pune, joins us this evening. Dr. Parmeshwar Arora, senior consultant at Arth Ayurveda. Dr. Shruti Tandon, consultant for critical care at Jaslok Hospital and Research Center, and Dr. Ravi Wankhedkar, former national president of IMA. He's treasurer for the World Medical Association as well. Dr. Wankhedkar, let's begin with you. Good evening to you. If you can simplify this for our viewers to understand, what is it that has happened right now that has the IMA so upset?
Very good evening. First, let me clarify your initial thought process or initial saying that this is a fight between Ayurveda and modern medicine. Kindly don't look at it this way. We are very much for Ayurveda to grow and progress in its own way. And we want that modern medicine should also grow, and every system of Indian system of medicine has its own place. Our main worry is the mixopathy, is creation of hybrid doctors. And this is not only this latest CCIM notification is the last straw on the camel's back. This concept of mixopathy has its origin from the bridge course, thereafter the National Medical Commission, section 50-51, the new education policy and the 4 working groups made by the Niti Aayog. All this indicate and have a stated objective of having hybrid doctors by 2030. Imagine that even on one side government says that we are allowing limited surgeries. Surgery is nothing limited. No surgery is minor. Even a simple tooth extraction can be dangerous to the life of patient. If you inject a local anesthetic for a tooth extraction and the patient goes in a anaphylactic shock, you need to have the expertise and the wherewithal to revive that patient. Doing a simple procedure of cataract, see, people spend 10 years doing specializations, and thereafter you have to do nowadays super specialization, sub specialization. This doing surgery is a very expert job, involves a team of anesthetists, pathologists, radiologists, and everything together. So you have to look at it in a composite way. You can't just say it is not just like prescribing, allowing prescription of 60 medicines. Surgery is a specialized branch, and we feel very strongly that this is an anti-people move.
Okay, so there are two aspects to this. Let me just also ask you to clarify, Dr. Wankhedkar, when you say hybrid doctors, what does that mean? And will a patient be able to identify a hybrid doctor?
That exactly is the point. The new education policy and the 4 working groups created by Niti Aayog have a stated objective to integrative under the garb of integrative medicine to create such khichdi or hybrid doctors by 2030. Imagine the plight of modern medicine doctors, who Indian doctors, we all are well aware, are known worldwide for their clinical acumen and their skills. 40% of the National Health Service in the United Kingdom is run by doctors of Indian origin, and 27% of the US health system are doctors of Indian origin. Nowhere globally we will be considered with this concept of integrative medicine, neither they will be accepted anywhere in the world. And same applies to our own country, where the patient will not be able to identify what kind of doctor he is. Even today, even the law of CCIM says that the MD Ayurveda or MS Ayurveda has to write MS Ayurveda or Shalya Tantra, but we are finding practically on ground that they write only MD or MS, thereby creating confusion in the minds of poor people, illiterate people, that what kind of doctor is he, a pure Ayurvedic doctor or a pure modern medicine
Okay.
doctor?
Let me get a response from the other side. Dr. Parmeshwar Arora, what is this hybrid doctors and what kind of skills do they have?
See, first of all, with due respect to my colleague doctor, जिन्होंने बोला कि 10 से 12 साल लग जाते हैं सर्जरी सीखने में, तो मैं पहले अपने मीडिया वाले भाइयों को और अपने दर्शकों को बताना चाहता हूं कि एग्जैक्टली इंडिया के अंदर इफ वी टॉक अबाउट द ट्रेनिंग, जैसे एमबीबीएस में होता है जहां पे एक बैचलर ऑफ मॉडर्न मेडिसिन सर्जरी बनता है, बिल्कुल उतने ही टाइम स्पान में एक बीएमएस डॉक्टर बैचलर ऑफ आयुर्वेदिक मेडिसिन सर्जरी तैयार होता है. उसकी भी 4.5 साल की ट्रेनिंग होती है, एंड आफ्टर ट्रेनिंग 1 ईयर इंटर्नशिप होता है एमबीबीएस डॉक्टर का, बीएमएस का भी 1 ईयर का इंटर्नशिप होता है. एंड आफ्टर कंप्लीटिंग दिस ग्रेजुएशन डिग्री, द आयुर्वेदिक स्कॉलर is also appearing for the PG टेस्ट. उसका भी कंपटीशन टेस्ट होता है. हर व्यक्ति पीजी नहीं कर सकता. 2000 लोगों में 20 सीट होती हैं, 15 सीट होती हैं, एंड देयर आर 22 डिफरेंट स्ट्रीम्स जहां पे आयुर्वेदिक स्कॉलर 3 साल की एमडी डिग्री और एमएस डिग्री, लाइक जैसे एमबीबीएस के स्कॉलर्स करते हैं, वो 3 साल स्पेशलाइजेशन डिग्री करता है. यानी इफ आई एम ए बीएमएस मींस बैचलर ऑफ आयुर्वेदिक मेडिसिन सर्जरी, तो मैंने बीएमएस के टाइम पे जो बेसिक सर्जरी है, मेरी डिग्री का नाम सुनिए, बैचलर ऑफ आयुर्वेदिक मेडिसिन सर्जरी, दैट मींस दिस सर्जरी हैज बीन इंक्लूडेड एज द बेसिक सब्जेक्ट इन द बीएमएस कोर्स ड्यूरिंग द ग्रेजुएशन. एंड आफ्टर ग्रेजुएशन इफ आई पास माय पीजी कंपटीशन एंड आई एम गेटिंग द सर्जरी ब्रांच, देन देयर विल बी 3 years special training for surgery purpose, and there are 22 different streams. MS means Shalye, ENT means Shalakya, that means that doctor will be allowed to do eye and ENT surgery. So there are different streams, and same way पूरा जिस तरह से MBBS 5.5 साल में होता है, 3 साल में उनका पीजी कोर्स होता है, ऑन द सेम पैरामीटर एग्जैक्टली आफ्टर 8.5 years आयुर्वेदिक डॉक्टर विल गेट पीजी डिग्री, एंड देन आफ्टर पीजी डिग्री द एमएस डॉक्टर विल परफॉर्म द सर्जरी. एंड सर्जरी भी कौन सी, जो उनके कॉलेजेस में आज हॉस्पिटल्स में उनको जिनके लिए ट्रेंड किया जा रहा है. एंड डॉक्टर साहब को यह बताना चाहूंगा कि आज भी आयुर्वेद में कम से कम सैकड़ों कॉलेज ऐसे हैं जहां पे हर दिन सैकड़ों आई के ऑपरेशन होते हैं, सैकड़ों थ्रोट के ऑपरेशन होते हैं, सैकड़ों और हर्निया के ऑपरेशन होते हैं, हाइड्रोसिल के
But
ऑपरेशन
PG
होते
students
हैं।
don't do those operations. Is that is
नो नो
that
नो
the difference?
नो नो, बेसिकली इट्स अ सिस्टम। प्रोफेसर जो सर्जरी के प्रोफेसर हैं, दे डू, द स्टूडेंट सी, देन इन एमएस और एमडी वी कॉल्ड एज रेजिडेंट डॉक्टर्स, एंड देन आफ्टर रेजिडेंसी देयर इज सीनियर रेजिडेंसी
So
आल्सो।
what
सो
has
इन
changed? What has changed, Dr. Parmeshwar Arora? What has changed? More kinds of surgeries have been allowed. Are these surgeries more difficult, more critical?
listen, listen. Actually, the present notification which has been issued by the government is just a clarification. It's not that now government is now giving permission to Ayurvedic scholars to perform surgery. It's just a clarification. This notification is not new. We are actually upset. ये गवर्नमेंट ने स्पष्टीकरण दिया है। एक्चुअली व्हाट वाज
So
हैपनिंग,
आप कह रहे हैं कि ये पहले भी हो रहा था, अब गवर्नमेंट ने लीगली ऑन पेपर लिख दिया इसको?
एग्जैक्टली एंड उसमें क्या था, मैं ये विद अगेन विद ड्यू रिस्पेक्ट टू माय आईएमए डॉक्टर, ये डॉक्टर्स की लॉबी इतनी तकड़ी है और बिकॉज ऑफ द फंडिंग गवर्नमेंट अनफॉर्चुनेटली अगर 100 रुपए डेप्यूट करती है तो 97 रुपीज गोज टू द मॉडर्न साइड एंड 3
Dr.
रुपीज
Arora, there is an entire ministry called Ayush ministry under the current government since 2014, 2015. अभी अगर लॉबी थी भी तो वो जा चुकी है, वो चार्ज तो अब नहीं रहा.
नो 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 नो
Can I come in? Can I come
Okay,
in?
let me get Dr. Ravi Wankhedkar to respond, and then I will go to the two ladies. I have some more follow-up questions as well. Yes, Dr. Wankhedkar, respond please.
Yeah, a very short response on the 2 points to my learned friend. And before I respond, let me also have to inform you that I am a professor of surgery also in the government medical college for last 30 years. And I am very closely associated with the surgical training and kind of surgical training. We are not debating whether the duration of Ayurveda or homeopathic graduates or their post graduation of how many years it is. What matters is the kind of training and kind of exposure, how you are going to do it. That is point number one. Let me finish. My dear friend, I didn't interrupt
if
you.
I am MD
My dear
medicine,
friend,
then
I didn't
I am not going
interrupt
to
you.
perform surgery.
Dr.
There is a
Arora, let him
consumer
finish, please. Dr. Arora, let him finish, please. Let's hear each other out on this debate. Yes.
We are doctors. Let us maintain the dignity of the
Yes,
debate.
don't remember, you're not politicians, you're doctors.
Yeah, and what allegation totally unfounded which he made that there is a lobby of modern medicine doctors. Let me counter argue it that this is the lobby of private Ayurvedic medical colleges who for last 10 years were not getting students because practicing pure Ayurveda was never a profitable venture. Illegally, everyone was doing modern medicine practice, and now
Okay.
what they are doing is trying to legalize it so that these Ayurvedic colleges survive and they get hefty donations.
So let me
And this is
clarify
nothing
this.
but-
Okay, let me clarify this. And Dr. Asmita, maybe you can come in on this. Is the point that these surgeries were already being conducted, it's just been put on paper now by the Ayush ministry?
See, if you ask me, this ACIM regulation for postgraduate education is in vogue since 1974. And after that, in 2016, there was amendment in this PG regulation, and they have clarified. My Ayurvedic friend, he has said that it is just a clarification of some specific surgical procedures. That's one thing. Okay, we are here in India, and we are in the society where there is medical pluralism.
Yeah.
What is expected is, yes, what is expected here is we should respect each other. Now, this particular listing out of about 39 procedures now of general surgery and ENT ENT ophthalmology. Okay. Now, first thing which I want to clarify, the news which is coming from here and there is Ayurvedic doctors are being allowed. It's not like that. No BAMS can do these surgeries. No person who does not have this MS specialization in general surgery Ayurveda and in general and in ENT ophthalm, that is Shalakya Tantra in Ayurveda, is allowed to do any of the procedures. So let's be clear on that. These are not postgraduate students. Once they will pass out having their degrees, then they will be able to perform these surgical procedures. That's what is the interpretation of this new thing which has come. It's actually not new, but it is a clarification of certain regulation which was there in 2016.
Okay. You are saying this is a clarification of a notification that came out in 2016, Dr. Shruti Tandon. Then if nothing's changed, are we simply using this as a tool to block the growth of Ayurveda?
That's a very good point, Tanvi, and actually that's the point I was trying to make. You know what Dr. Asmita said, these branches are here to complement each other and not to block each other. So the very fact that we have a system of homeopathy, Ayurveda, which exists in our country and not other countries, is that these should be allowed to grow in the field that they are specialized to. So it's very sad that we now have Ayurvedic and homeopathic doctors who have to practice allopathy in order to earn a living. The reason that they are employed in ICUs is because they won't get ably paid elsewhere. And I practice in the intensive care, and in one of the hospitals where I practice, Ayurvedic doctors are employed because we know that they won't leave. We train them in procedures, we train them, but that's not the correct use of the science that they have been trained to do. So without siphoning them off to another field, I think pure Ayurveda and homeopathy and Ayush as a branch should be allowed to flourish in their own realm of their training. And coming back to, saying that they have been trained in post-graduation, then if such a clarification has come in today, it's because how many of us, I mean, I'm asking you this question, I'm not even referring to politicians, but let's look at the educated class. How many of us will actually go to an Ayurvedic or homeopathic hospital to get a cataract surgery done or get a foreign body surgery done?
Okay.
And because the volume of patients visiting there is less. See, post-graduation training is all about volumes. You're observing, you're practicing, and you continue to practice even later. So the best medical training is in the high volume centers. When you don't have high volumes, you're not going to have that kind of training. You will not be skilled to do these procedures even after you're certified, board certified.
Okay.
So yes. So whether it means if you're going to have the same skill set and you're going, then yes, by all means it should be allowed. But like doctor correctly pointed out that if you're just going to do this to get more and more people attracted to Ayurvedic colleges, more hefty donations, and make this like see, if you don't believe in the science of Ayurveda, then I earnestly request the health ministry to then abolish this. We need more doctors. Let everybody get into MBBS. Most of the times you have people who have chosen Ayurveda and homeopathy for the sad fact that they did not get admission into MBBS. So this should not become an alternate route to enter. These sciences should be allowed.
Okay, so you've raised three multiple points. If I can just come back to the first point that you raised, Dr. Shruti Tandon, which was to say that, there is a skill and there is, a certain set of expertise under Ayurveda, and that's what they should stick to. If you pull them out of there to perform other kinds of surgeries, it could get complicated. But
and then who will handle these complications? So you spoke about tooth extraction. I'm not even talking about anaphylactic shock, but
isn't Shalya Tantra and Shalakya Tantra and a lot of other these forms teaching them these procedures?
Yes. So I can come back on it.
What's the volume of procedures that they're learning?
Okay.
What is the volume of pre-operative and post-operative care that they're learning? So something as simple as a tooth extraction can lead to a complication called infective endocarditis, where you can get infection in the heart valve, which can need 6 to 8 weeks of antibiotics and intensive care. So are we equipped to screen those patients? There are guidelines. There are the scientific evidence behind this.
Okay.
So we need to respect each other and draw our boundaries and respect those boundaries.
Okay. So now I am trying to simplify this as much as possible for my own comprehension as well, Dr. Asmita. So now it's also about the fact that the Ayurveda doctors or those who are learning the science and training for it aren't getting enough practical exposure during their course to then carry out these surgeries once their academics is over.
Yeah, let me come back to you on, and there are 2-3 points which Dr. Shruti and Dr. Wankhedkar, they both are saying again and again that this is something high-tech, and they are also saying there is controversy in their saying. They're also saying that they are employing Ayurvedic graduates, postgraduates, and then they are teaching them. On one hand, that means they are accepting that they are worthy
No,
of
Dr.
training, they are
Asmita.
worthy of teaching. And
Yes,
then,
no, Dr. Asmita,
yes,
we are teaching them
just a
intensive care
moment.
procedures.
It-
Okay, simple
There
things
are,
like placement of peripheral lines, rise tube,
no, just
Foley's
a moment.
catheters.
Just
Okay,
a
yes.
moment. They are
And I also
at
specify that the sad
there
reason
are
why we are employing them, yes, the sad reason
there
why
are
we are employing them is
no. I
because they will
don't
not
agree
earn
with
a
what.
living elsewhere. They will not
Let
earn
me
a good,
speak.
respectable living elsewhere.
Okay.
And
Let
I
me
wish they would earn the same living being able to practice the science that they have been trained in, because it is a good science, but it's not been given that
Okay,
kind of
okay,
respect in our society
okay.
because we are making rich
Let
courses.
me speak. Huh?
Yes, ma'am,
Now
please.
I have heard you out completely. See, if it is a good science, if you respect the science so much, which is, but you are always saying it is ancient and you should practice your own science. Ancient
I
doesn't
didn't say
mean
it's ancient.
old, okay? No,
I
generally
didn't
it
say
is
it's
said.
ancient.
And now what you said right now, that we are giving them only this much training, that much training in all over India, they are doing n number of practices. We have three-tier cities, first tier city, second tier city, and our rural area. And everywhere you will find BAMS doctors, Ayush doctors practicing and doing everything. Like you said, a simple tooth extraction can lead to cardiac complication. Similarly, even a simple wound he is suturing might lead to something else, and anaphylactic shock is
Absolutely.
completely different thing to. Yeah, I understand that. Okay, but definitely in all our centers, we are we are calling radiologists, we are calling surgeons who are trained into modern medicine, and all these postgraduate training centers and institute, they are using your expertise to train the postgraduate students. So do you mean that they are not good enough to train the doctors who are taking the PG
I'm not
training?
even saying,
See,
no, I'm not
there
even
are
saying that they are not
so
good
that's
enough. No,
what
I agree with you.
that's what is actually
The fact that
happening,
they are a
and
few,
therefore
no,
they
there are a
are.
few marks. No, there are a few marks behind MBBS. They chose to take BMS, BHMS. I'm saying if that's the case, why
Let
not
us
open
not
up
mix
more
here.
MBBS? Why not
Let
open up
us not
allopathy?
mix two,
You
three
decide if
different
you want
issues
to practice
together.
allopathy or homeopathy. Okay, don't mix
That's
the
what
two.
you are. See,
That's what we're
Dr.
Can
talking
I
about
come in?
Wankhedkar
mixopaths.
commented on that
Okay.
also. He said that when Niti
And
Aayog is now
let me tell you,
planning
if
Right.
you're talking,
20
yeah,
one nation,
So
okay.
one
one minute,
medical system.
let me pick up this other point about mixing, because that's also what
Tanvi,
Dr. Wankhedkar said. Dr. Wankhedkar, it's the mixing of the two that's a problem, but the two
Yes.
sciences are working on parallel, and if via Ayurvedic procedures they do carry out surgeries, is that a problem?
Yes, exactly. Very short, few quick points. One, repeatedly it has been said that this is just a clarification. This clarification is the deception of highest order. I will clarify about this clarification later on. I entirely agree with Dr. Shruti, and again I will reiterate that we have all the respect for our traditional Indian systems of medicine, which basically is Ayurveda and Unani and Siddha. Homeopathy is not even Indian. But if we really want to make them grow, if we want them to flourish, please don't mix the systems. What on the ground, what we are seeing, that our Ayush colleagues are legally, illegally using modern system of medicines and not practicing Shuddha Ayurveda. Except very few centers, especially in the state of Kerala, most of our colleagues are practicing all the modern medicine, doing all the procedures, and but whether this is legally sound or not, because in September 2 months back, Bombay High Court punished two Ayush doctors for performing a surgery, and even a modern medicine anesthetist was punished because he gave anesthesia to that particular patient and he succumbed. And in that judgment, it is very clearly said that they are not allowed. This
and is it
particular
fair to the
clarification,
patient?
They
yeah,
were just BMS doctors.
let me complete,
Listen, they
Dr.
were just BMS
Parmeshwar.
doctor. They were not MS or MD.
Dr.
So that's
Parmeshwar,
why.
let me complete it. Dr. Parmeshwar, my humble request. In the judgment, if you read the judgment very carefully, the Honorable Justice observed that legally this is not permissible for Ayush doctors to perform any sort of surgery. Hence, this clarification, what I am saying is a deception. It is nothing but a step ahead in towards mixopathy. We are definitely for pluralism. Everyone should limit themselves uh, so that their own system of medicine will further grow. Personally, I will tell you, I being a trained anorectal surgeon, Ayurvedic anorectal surgery is a very well developed branch. And when I entered this field 25 years back, I went thrice to the Ayurvedic University of Jamnagar and stayed there for 2 weeks to understand what is the principle, what is the technique. I don't do that. But because I had a respect for that particular and it was my field of interest, I went and studied that. See, such kind of study and disciplinary cooperation is 100% welcome. But this doesn't mean we exceed our boundaries to mix it. Otherwise, what will happen? As I said, such type of khichdi or hybrid doctors in the years to come will be totally detrimental. And Shruti is very right.
Okay.
Government then should
I
close
have to,
down all
I
the
have to
MBBS
make,
and should
I
have
have to
only.
make one.
Yes,
One
no,
point here.
one by one,
Dr.
please, one
Wankhedkar,
by one. May I just
yeah.
go first to Dr. Parmeshwar Arora, your point,
Okay.
and then to Dr. Asmita.
Ma'am, actually, right now, what we are discussing is discussing about the surgery.
Correct.
And surgery and medicine, they are two very different streams. If we talk about the MD medicine, right? I am MD medicine, so I practice only and only Ayurvedic medicines. So for medicine, it's okay. I should practice Ayurveda. When it comes to surgery, it's a procedure, it's a technique. What the modern surgery is using, some machines. So all the machines, they are the प्रोडक्ट्स ऑफ द इंजीनियरिंग कंपनी दे कम फॉरवर्ड हमारे अच्छे के लिए कुछ वो एंजियोप्लास्टी का इंस्ट्रूमेंट लाती है टेक्निक लाती है आज हमारे पास पल्स ऑक्सीमीटर है सो दीज आर इवोल्यूशनरी मशीन्स लेकिन मॉडर्न के साइंस क्या बोलता है कि ये मशीन क्योंकि आधुनिक है मॉडर्न वर्ल्ड में आई है तो आयुर्वेद डॉक्टर जो है इसको यूज नहीं करेगा सो सर्जरी बेसिकली सर्जरी इज वेरी डिफरेंट फ्रॉम द मेडिसिन सर्जरी इज ए प्रोसीजर एंड उसके बाद जैसा अभी डॉक्टर साहब ने कहा कि साहब अभी हाई कोर्ट ने डिसीजन देके उनको जेल में भेजा मैं पूछता हूं कि अगर कोई एमबीबीएस डॉक्टर गलत सर्जरी करके किसी पेशेंट को मार देगा क्या उसको जेल नहीं होगी उसको भी जेल होगी देयर इज अ कंज्यूमर फोरम आज मैं एमडी मेडिसिन हूं मैं थोड़ी सर्जरी करना शुरू कर दूंगा एंड एक और बात खिचड़ी हाइब्रिड इन शब्दों का बड़ा प्रयोग हो रहा है मैं आपसे पूछता हूं कि अगर आपको पेट में दर्द होता है आपका जी मिचलाता है तो आप किचन में जाकर के पहले आप ब्लैक पेपर काली मिर्च खाते हैं पुदीना खाते हैं एंड इफ यू डोंट गेट ऑल राइट यू गो टू नियर बाय डॉक्टर लोकल डॉक्टर ही गिव्स यू वेरी सिंपल मेडिसिन एंड इफ यू डोंट गेट ऑल राइट देन यू गो टू द हायर सिस्टम तो आप क्या खिचड़ी खा रहे हैं कि आप हाइब्रिड हो गए So please
But
don't
Dr. Arora, those are, simpler solutions we find to our daily problems. Surely we can't compare that to very critical, life-threatening surgeries to begin with.
Definitely.
Also, you're going in a stepwise fashion.
Yes, Tanvi, I
Training
want
will be
to,
given in Ayurvedic colleges. They will perform those surgeries. ऐसा नहीं है ना किसी को आई की सर्जरी नहीं आती वो आई काट के बैठ जाएगा. You try to understand. आज कंज्यूमर फोरम है आज मॉडर्न नहीं सर मॉडर्न सी हमारी सर्जरी इफ यू टॉक अबाउट हिस्ट्री दिस इज सुश्रुत संहिता ये आचार्य सुश्रुत हैं who is well known
No, so Dr. Arora, let me make this clear. I don't think there are any doubts. I don't think there are any doubts about the efficacy of the science, whether it's Ayurveda or even the modern science. And I don't think any of the four panelists here on this debate tonight or me are questioning that. It's simply about what have you been trained in and what are your skills about. The last debate we had on it was when the new bill came out and there were these bridge courses that were announced, and the objection from the other side was these bridge courses don't give you enough time to learn these skills, to practice enough to start using these procedures. So I understand that part. Yes, Dr. Asmita wanted to make a point. Go ahead, please.
Yes, you perfectly pointed out that we should be trained and trained into performing these surgeries. Okay, now if you go back to the Sushrut Samhita, there are 186 chapters. 300 surgeries are mentioned in detail, and I'm happy that Dr. Wankhedkar had been to Jamnagar, University of Jamnagar, and he has visited at least for anorectal surgeries. The first the Association of Indian Plastic Surgeons, they revere Sushrut, and they have symbolized Sushrut on their emblem. Their logo carries Sushruta for the father of plastic surgery. And people from abroad, people from all over the world, European surgeons, American surgeons, they are mentioning it, and there are a lot of papers, research papers talking that yes, Indian method of rhinoplasty and plastic surgery is the best method, and that has been modified further. Okay. Now when this is the case, then what we are training to our students, those 300 basic procedures and their proliferations and modifications, that's what we are training and teaching our students. And if it is in the syllabus of at BAMS level, it is at the introductory part. And when they go to the post graduation, they have been trained from the modern science practitioners, surgeons.
Okay, so I have a question for you, Dr. Asmita, and then Dr. Shruti can come in on that. Tell me this, because Dr. Asmita, you are a professor in a university and you teach.
I'm saying, and
is there a difference in the level of training, practical training, that Ayurveda doctors get versus the others?
No, my last point, just a moment before going to this question of yours. Both my learned colleagues are saying that there is a private college and they want to get students and this and that. I don't want to enter into that. Let us strictly be on the syllabus, the training, and what the degree and what the law says.
Okay.
So this regulation of post-graduation clearly gives the mandate that, okay, we are training, we are doing it, and then they should be protected if anything happens, if any mishap happens from that surgeon's hand, which is similar to what protection you get for any modern surgical practitioner. And that's it. It's as simple as that. So I don't think that there is so much. There are lots of others. There are microsurgeries where there is a lot of huge field open for super speciality for all the modern surgeons. And every science builds on the tradition. Every science takes up what is the prior knowledge, prior art. So Sushruta Samhita, if it is taken as the basis and the origin of surgical practices coming from Indian continent, which is accepted by all the surgeons in the world, what's wrong? What's the problem? Why should not Indian surgeons accept it, try to learn it, try to build it? And when the ministry and the Niti Aayog is thinking of bringing a new system, why there is so much of opposition? I don't understand this.
Okay. Dr. Wankhedkar wants to say what's wrong.
Yeah, firstly, a very small point which my learned friend Dr. Arora made, that it is the machines. My dear friend, the machines don't really matter. The man behind the machine matters. You may have the most technologically advanced machines. May it be a simple laparoscopy, may it be a simple cath lab. You may have the best cath lab, you may have the best PET scan, MRI scan. But if the doctor is not trained,
we know
then
lot of
let me complete
doctors
it.
doing
Let me
better
complete
surgery
it.
than allopathic doctors.
Let me complete it. Let me complete it. Please, please. And Dr. Asmita made a point that let's not go into the debate of private college. I can understand she working in a private college, but the sad fact remains that the policies are guided. And as we all are aware that all the private colleges cutting across party lines are owned by politicians and they dictate the policy. Third point is, we all respect Sushruta. Again and again we are saying this. We totally respect, but this doesn't mean that you encroach
this
upon
is an empty respect. You are not doing anything. This is empty respect.
Dr.
Don't tell me then.
Asmita, let me complete. I didn't interrupt you. I didn't interrupt you. Please let me
Modern
complete.
surgery has hijacked our science.
Let me complete the. Don't show me that book, Dr. Arora. I have read it completely. In my clinic also, you will find the Sushruta's photograph is there. This doesn't mean.
Okay, may I please, let me just say that this has happened in the past as well. We all start off by agreeing that we respect all both kinds of science here. But there are technical details where there is disagreement. So let's stick to those. I don't think it's a conventional ancient science is of no use in 2020 kind of a debate. Yes, Dr. Wankhedkar, finish your point, please, and Dr. Shruti can come in then.
As a professor of surgery, I have been training postgraduate students. Surgery is not just doing the technical procedure. Even my OT assistant who is working with me for 25 years will be able to perform much better surgery than even my MS student. That the technicality or the machine doesn't make the surgical procedure. It is the entire knowledge, it is the experience, it is the training which we impart. It is like a guru shishya parampara, which the niceties which are not mentioned even in the books are imparted, and that training starts right from first MBBS, the anatomy, the biochemistry which goes on, the pathology which has to be seen. And my learned Ayurvedic friends will now argue that all this is all this is included in our syllabus. But then, as Shruti has rightly said, close down all Ayush colleges and make all MBBS colleges. And
No, why
100%
all
will
MBBS
oppose
colleges and
Newton
make
May.
Ayurvedic colleges?
Oppose
We should
Newton May
make Ayurveda
MBBS
as our
studies
Rashtriya Chikitsa
proposed
Paddhati.
by
It should be
Okay.
Niti
the
Aayog.
national
May
medical system,
okay, all
and
right.
this
Dr.
chemical
Shruti
branch should
Tandon
come
wanted to
under
come in.
Ayurveda. Actually, now we are independent. हमें अपनी आयुर्वेद चिकित्सा पद्धति को फिर से नेशनल सिस्टम ऑफ मेडिसिन बना करके एलोपैथ को बंद करके आयुर्वेद के अंदर में लाना चाहिए.
Health of
Okay.
poor
May
people
I
of
just
this
bring in Dr. Shruti, please? Yes. I think you've muted yourself, Dr. Tandon. You'll have to unmute. No, still can't hear you. We may have lost the audio line there.
ठीक, मैं 30 सेकंड में आपको हिस्ट्री बताना चाहूंगा. हमारा जो इंडिया है वहां पर सिस्टम ऑफ मेडिसिन के नाम पे वी हैव द ओल्डेस्ट एंड द बेस्ट सिस्टम ऑफ आयुर्वेदा. एंड उसके बाद में आयुर्वेद था, वैद्य जी होते थे. एंड बाद में हमें मुगल आए, उन्होंने शासन किया, अतिक्रमण किया और उसको जो है यूनानी में
Okay,
कन्वर्ट
but
करके
Dr. Arora,
अब
tell me
वैद्य
this.
जी
The
नंबर
question
पे आ
is
गए.
this. The problems of today may not have existed in that era. The diseases we are finding today, the technology that is being used today, the medicines that are being used today is very different. Now,
even in this COVID crisis,
Yes.
has any of the ministers or bureaucrats or any of my esteemed colleagues have taken treatment from Ayush? They
no,
all have
ministers
gone to
never take
modern
Ayush
medicine.
treatment for serious problems. They always go to AIMS.
A lot of
Yes,
allopathic
they
doctors
go
are
to
coming to
Medanta,
Ayurveda doctor for their
they go to
fissure and
Leelavati.
fistula treatment, surgeries. So you please, you
They
have, I
whatever
mean, you
surgeries
don't
they
know the
want to
things
perform,
completely.
they
You see
perform in the
what
modern
Ayurvedic
medicine
doctors are doing.
system. Why they are not following?
See.
If the Niti Aayog chairman, vice chairman falls ill, it has to undergo some major surgical procedure. Is he ready to undergo from Ayurvedic doctors? That is my moot question.
Not at all.
Tanvi,
Definitely, जिसकी
Tanvi,
ट्रेनिंग आयुर्वेदिक सर्जन ने ली होगी उसके लिए वो अलाउड है और लोग आएंगे. देयर इज द
अरे
पीपल्स
तो
चॉइस. एक
अरे
गांव का
अरोरा साहब,
डॉक्टर, एक
आपको
एक
अगर
गांव का आदमी
कैटरेक्ट
क्या यहाँ
सर्जरी करना
वेदांता
है
में
तो
आके
क्या
ट्रीटमेंट
आप
करा सकता है?
Okay,
आयुर्वेदिक
okay,
सर्जन नहीं करा?
gentlemen, take a deep breath. थोड़ा सा पानी पी लीजिए. फिर डॉक्टर श्रुति टंडन का ऑडियो वापस आ गया है. Let me go across to her.
With all due respect, we are all part of a medical fraternity, and it really is reflecting on us towards our patients who have the utmost respect in us. I think the middle path for this is, I understand that there are certain surgeries like anorectal surgeries. I'm not a surgeon. There are the whole dermatology. I know that, for example, for dermatitis, there is very little that we can do in allopathy, but there's a lot more that Ayurveda can do. The truth here is possibly a middle path. But Dr. Parmeshwar, just in response to what you said, it's not machines. I would agree with Dr. Wankhedkar. When we started off, we were asked what is the most important part of the stethoscope, and it's the part between the two earpieces. So when I was a student at KM Hospital, I wouldn't agree more with sir. We had people who were OT technicians. When we were training as MBBS students to perform simple surgeries, excisions, he would take over and get the cyst out in few seconds and hand it over to us. And I would be stunned. But they never went on to do surgical procedures because it's not the technicality of the procedure which is important, but it is the person who is doing it, the ability to handle complications. When I learned my first central line, my resident was sitting and 2 meters away and he told me, go ahead, Shruti, you can do this. And I said, no, I've never put one before. He said, you will do it. He sat there, he gave me instructions because he was so confident that if I make a mistake, he will manage. And his confidence saw me put the line. That's the kind of confidence that a teacher must have and a doctor must have. Now, if there are procedures which are done with superiority or with a superior technique in Ayurveda, very well to welcome them, amalgamate them into a general practice and maybe form an Indian system of medicine. But to say that, we will technically teach them to do a foreign body removal, which is where allopathy, a science which is backed by a lot of scientific evidence. And I have a lot of respect for ancient Indian medicine. I don't know, Dr. Asmita, you may say it's empty respect, but there's no way I can open up my heart and show you. But we need to find a middle path, and we really need to possibly form an Indian system of medicine where these can be amalgamated. But to say that I'm an Ayurvedic doctor because I can't make my ends meet, Therefore, I'm going to practice allopathy a little. See, when I'm taking black
says
pepper
this?
and tulsi, okay,
Who
it's a home
says
remedy.
this?
I'm going in a stepwise
One
fashion.
simple question from Dr.
I
Shruti.
can't
Please
flex
let me
Without
my
complete.
two
having
ends
Please let me
confidence,
meat.
complete.
how
This is
Ayurvedic
a
No,
surgeons
let
are
me
developmental
complete.
performing
I'm
statement.
hundreds
going
of
in a
Nobody
surgeries
said
stepwise
in the
this.
fashion.
hospitals every
Okay,
day?
one at a time.
Why
Let me
how you
get
can
Dr.
say
Asmita
about
to respond to
confidence?
this because
Are
Dr.
doing
Shruti
hundreds
Tandon
of
had
surgeries every
made
day
this
in the
point earlier
hospital. How
also.
they are
Dr.
they are not
Asmita, is
confident?
there a problem?
Yeah.
Not deal
The
with the complications.
1 minute, please. Let me get this clear. Is there a concern that those who are taking up, Ayurveda or homeopathy and studying these sciences are not getting a full-time career option after that, which is why it's perhaps also simpler to open up a partial allopathy route for them to continue earning money. That's what the point is. Dr. Asmita,
No.
respond to that.
No,
Yeah,
no, things
no,
are not
that
like
is
this.
not the
Things are
point,
not
and
like
that
this.
is not the
Basically,
intention.
No, the
Both.
point is
We are
also
very clear.
the
That is not the point, and that is not the intention. See, people do whatever they want to. There are many allopathic doctors who do not practice, who chose other professions. Many of I have met many of allopathic women who are not practicing at all. They want to do home. So there is personal choice in this. The intention and the legality and the admissions and everything for any
they
Ayurvedic
want to do
doctor
home.
is to make a good doctor.
No, they want to do home,
To
but
make a
are
good
they
doctor,
practicing
just
homeopathy?
a minute, just
No,
a
are the
minute. So
Ayurvedic doctors practicing homeopathy or Ayurveda? Find me
see,
one allopathic doctor who switched.
there
That's the
are
point you're
many
not getting.
allopathic
And how
doctors who
many? And
prescribe
no, and
many
Dr.
allopathic
Smita,
doctors prescribe
on a
Panchil.
percentage
Many
basis, how
Ayurvedic
many people
doctors.
have
And I
chosen
will give you the reason. I
Ayurveda
will
and
give the reason.
homeopathy as
Because
a primary field when they
allopathic
were getting
doctors
MBBS?
are not getting
They're
training of
taking exam
Ayurveda.
for the
That's why they
post.
are not capable of prescribing even a single Ayurvedic medicine. But Ayurvedic doctors are having training for the
Just
modern medicines. They are passing pharmacology,
Dr.
pathology,
Parmeshwar, please don't
medicine.
fool us.
That's why they dare to
Okay,
prescribe the
Dr.
I
allopathic
think
medicine.
I
Parmeshwar, please
This is
definitely
the
feel that
difference.
there is
Because
some
I'm
Ayurvedic
merit to the
doctors
point.
are not getting trained.
I am
Obviously, a
making
lot
a
of our
point, Tanvi.
youngsters
Can
who
I?
are even training or
I'm
studying
making a point,
traditional
Tanvi.
sciences. I'm sorry, I'm completely out of time. I will have to thank all of our panelists for joining us. It's been an enlightening and a very, very interesting conversation to say the least. But if the intention is to give a platform for our traditional sciences and the alternate sciences to grow and to utilize their positives and their skills and their expertise in modern day era, then perhaps a deeper thought process needs to be put into place as to how we are charting out that route. It cannot be that those who are being allowed to conduct the surgeries aren't getting enough training in their own traditional science to do these surgeries. And if it is indeed a switchover to allopathy, then are we training them enough to put them on par with the allopathic doctors? That's essentially what this fight is about. The government, though, has made its stand very clear. Completely out of time. Thank you for joining us on this conversation.